So toddlers, they're going to run, they're going to jump, they're going to climb. You have to expect them to get some type of injuries. We're talking about wounds and bleeding. Now, the vast majority of these injuries are going to be kind of minor scrapes, bumps, and bruises. We're going to talk about what you can do to help your child who may have fallen and develop some type of injury like this. So remember that skin injuries can range from kind of more minor scrapes and abrasions, as we call them, or more major cuts that are actually going to require some stitches. Minor scrapes and abrasions, little bumps and bruises, all they need to be is cleaned off a little bit, maybe a little bit of antibiotic cream, a Band-Aid, and a mother or father's kiss. You want to watch the wound every day. You want to make sure it doesn't get infected, looking for things like redness or increased pain or kind of a swelling or drainage to the area. But the vast majority are not going to get infected, and they're going to heal up just on their own. If you're worried at all that your child's wound may be getting infected, you need to call your doctor or go to an emergency room to have it evaluated immediately, because it may need antibiotics.
And that's redness or drainage, particularly drainage that's kind of thick.
Exactly.
Kind of whitish looking.
Exactly.
Whitish or yellowish. Now, sometimes lacerations, the cuts, will actually need to be addressed by a physician. And the things that will tell you that are if they're bleeding and you can't stop it, or if the wounds gape, the edges of the wounds actually split apart. Now, bleeding, you need to take care of by basically putting pressure on whatever is bleeding. Never make a tourniquet. Tourniquets cause way more harm than good. So you don't really want, basically what you take is some clean cloth or even a Kleenex, push it on the wound and just hold it there. To keep peeking underneath every few minutes or so, make sure it stopped bleeding. If it's still bleeding after 5 minutes, you need to come on in. And there may be a little blood vessel we need to just fix. So that's an indication for you to come on in. If the wound edges are gaping, it may need stitches, or more commonly these days, we're gluing these wounds in children so that you don't have to have the whole rigmarole of getting stitches and all the things that go with that. A lot of these wounds, depending where they are and how big they are, we can actually just put a little glue on, and the child's really no worse the wear. So don't tourniquet, bring them to the ER if you're worried about bleeding, and if the wound edges are gaping, come on in, we'll fix it.